We'll just begin by acknowledging the traditional custodians of the land on which we meet today. We would like to pay my respects to the elders past, present, and extend that respect to those in the meeting who identify as First Nation people or a Torres Strait Islander. So we have some learning outcomes that we'll endeavor to meet. Number one is describe what artificial intelligence is and outline its main principles as they apply to healthcare. Recognize the main advantages and potential challenges of using AI in healthcare settings and assess the key considerations involved in introducing and integrating AI technologies within the healthcare services. And just to introduce Wendy, Wendy has 25 years experience in general practice. She has worked for the past 15 years as a full-time practice manager in a 24-doctor general practice in Gisborne, Victoria. And Wendy has worked in all aspects of general practice, including reception, practice nursing, and practice management, and has a strong comprehensive understanding of all facets surrounding each area. She currently manages 15 reception and admin staff, 5 chronic disease nurses, and 8 practice nurses, and is responsible for IT, daily operations, and induction and mentoring of new GPs and medical students. She also prepares the practice for the 3-yearly accreditation cycle, having received the AGPO Rule Award for Excellence in General Practice in 2019. Wendy thoroughly enjoys working with other practice managers and GPs to share her knowledge, particularly around MBS education and all facets of general practice, and has been delivering education sessions since 2017. So I'll hand over to Wendy.
Thank you so much. Now, can you see my screen?
Yeah, I can see your screen.
Thank you so much, David. Great. Thank you. Welcome, everyone. As Yambia said, it's a pleasure to have you all here today to discuss this very relevant topic to us in general practice. We fully use AI in our practice, so I'd like to share with you how it works, why it works for us, and how it could potentially work for you. We're going to cover off on what it is, how it works, the potential challenges you may face, along with key considerations when you're looking at integrating it into your practice. So let's get started. So the learning objectives have already been outlined, but I'll just quickly cover them off again. Describe what AI is and outline its main principles as they apply to us in healthcare. Recognise the main advantages and potential challenges of using AI in healthcare. And of course, assess and understand the considerations of how you can introduce AI into your workflow and what to consider to ensure patient safety and data integrity is maintained. So, what is artificial intelligence? So basically, artificial intelligence is a set of tools that we use in order for us to do multiple tasks. So analysing information, recognising patterns and learning from this, and supporting clinical and administrative decision making. The key word in this is supporting. It's not designed to replace clinical judgment, and it is purely a process of streamlining. Sorry, I've just lost myself there. A process of streamlining processes, making them faster, more efficient, and more informed. When we look at the relevance, how relevant it is becoming in general practice, it's becoming increasingly relevant with many more healthcare providers choosing to use AI tools in some form. However, surprisingly, at least 80% of GPs have reported lack of knowledge on how it actually works. AI works best when it's integrated with your appointment bookings. So we use AI when we have our appointment bookings. HotDoc, AutoMed are all forms of AI. chronic disease management, lots of processes that help us to identify patients for chronic disease. Cubico, for example, is another tool we use, which is AI-based. Documentation, so because the key, I guess, for today is the documentation of conversations between patients and, of course, patient follow-up. So AI does a lot of that with recalls and reminders through different platforms. It's basically another tool in our clinical toolkit, just like our therapeutic guidelines, our software, or any diagnostic tests. So AI Scribe can reduce administrative tasks for GPs, so reduce the burden on you for what you do every day, with the focus of creation of clinical notes, referral letters, care plans, and so much more. It allows the GPs to focus on their patients during the consultation instead of the computer. You're not looking at the computer, you're looking straight at the patient, face to face, and engaging with them, which from all feedback we've had, patients feel much more, they feel heard, there's increased satisfaction because they feel it's a conversation and not a one-sided process. And AI Scribe can certainly help with the reduction of GP burnout. So that whole analogy of working smarter, not harder. So how does it work? How does AI work, or how does AI Scribe work when you're looking at within general practice? So basically, AI is a tool that can automate parts of the documentation process for medical practitioners. So again, it allows you to engage with that patient face to face and have a whole consult instead of facing a computer. It converts conversations with your patients into clinical notes in a form of text. It can also create summaries, so health summaries or referral letters that can then be incorporated into your patient's health record. AI scribes, there's many names for them. The most common are digital scribes, virtual scribes, ambient AI scribes, AI documentation assistants, and of course, digital, virtual, or smart clinical assistants. So lots of names. Basically, the simplest form is to talk is AI scribe, which is what we use in general practice. So AI scribes are notably used in healthcare settings to generate structured, detailed clinical notes from a doctor-patient consultation, automatically drafting referral letters, discharge summaries, care plans, and patient information sheets to assist you in ensuring that your time is spent with the patient and not on paperwork. It reduces the administrative burden on clinicians by handling the bulk of the documentation work. So again, freeing you up to just be present with the patient during the consultation. When we look at how it's used in our practice, we need to ensure that we also consider the possible risks. So with AI Scribe, it will also automate or suggest possible diagnoses. It will flag risks, and it will support guideline-based care. It automates tasks like recalls, appointments, triage, and inbox, just to name a few. And let's not forget that whole documentation process. It helps identify patient cohorts that need follow-up or preventative care, improving population health planning, and it also provides automation for messaging reminders and personalized education resources. So being able to provide the patient with resources relevant to the consultation that you just had. The clinical applications, when we talk about patient handouts, there are so many, it's fantastic. There's a huge resource of online templates available to you to use, and each software has its own. So depending on the choice you make for provider, there'll be a whole library of templates that are available for you to use. But the patient handouts are great in answering patient questions. So they're given a wonderful printout, which will basically explain the reason for their visit and what the diagnosis and recommendations were, and it will allow you to print that in a handout that you can provide to the patient. It also gives lists potential side effects from medication that you may be prescribing, and it simplifies the jargon that we tend to use in general practice into a patient easy to understand handout. It provides treatment and medication reminders. So if you're prescribing medication and you're giving the patient a regime to follow, sometimes they get a little bit confused and they're not quite sure what they should be taking or when they should be taking it. It will also allow you to provide that information. It provides full translation service. So you'll be able to translate the information into multiple languages, particularly if you're in a multicultural clinic where you've got lots of different patients from different nationalities or ethnicities attending your clinic. Not all of those are strong English background speaking. So being able to automate that into a process or to a format that they're actually able to read is great. It also guides patients to appropriate resources by providing links that you can then hand over to the patient to give them, here's some possible areas you might want to check out. The final thing, of course, is allowing patients to track things like their blood sugar, blood pressure, or other health markers. So as you can see, there's so many benefits to it. It's amazing. So how does it work? AI Scribe uses a microphone to capture any speech that occurs during a clinical encounter. The capturing of audio will not start until you press record. So you can, perhaps wait until you've started the consult with the patient before you press start, or you can start it before you take the patient in. That way it allows you to capture not just the clinical side, but the full transcript of the conversation, particularly if there is questions later about what was said during that time. The technology then converts this captured audio into data or into a text version. Most AI Scribe providers do not store that captured audio. So therefore, once the consultation has been completed and converted to text, the audio is no longer available. So you can't replay the audio at a later date, nor can the patient. So it's basically ensuring that the privacy of the patient is kept by basically deleting that voice recording and leaving you with a good set of comprehensive notes you can then put into your software. Then, using that text transcription, the AI Scribe leverages the connections between the words and the concepts on which it's been trained. So AI is constantly learning. As you use AI in your practice, it will actually learn with you. So if you are constantly making changes to the format after the transcription has been completed, you might want to change, you might want to correct a word that's been spelt wrong or change something. It remembers it. So it learns your way of consulting to make sure to keep your notes generated in a simplistic form, which is great for you because it's how you want it. And that's what's important, so that you can, it's going to save you time if you're not having to constantly reword what's been written. So what do I need to get started? Simple. You just need basic tools. You're going to need a computer. It can be a laptop or a desktop that runs the AI Scribe program and is able to capture audio. So something that has a speaker built into it. You're going to need a microphone that can accurately and clearly capture audio. So you might want to use a standalone microphone. We tried it initially with the computer-based microphones, but found that depending where the patient sits in your consultation room, the audio wasn't really always the best. So we chose to go with standalone microphones. They're not dear, and they're a great way to fully capture. You can position the microphone between yourself and the patient, and it allows that full capture of those clinical notes. Obviously, a reliable internet connection if you're using cloud-based AI Scribe. So if you're using, most of them are cloud-based, so you will need a good, reliable internet connection to ensure that you have continued access to those notes. And also a good idea would be to have a second screen. It can be helpful for reviewing consultation notes generated by AI, but simultaneously viewing the patient's encounter, making sure that all that information that you have entered is correct and that you're happy with what the final product is before you copy it over to your health records. AI Scribe does not and will never completely replace the work GPs typically undertake to prepare clinical documentation. By this, I mean the output must be carefully checked by the GP to ensure accuracy. So it is an artificial technology. There are going to be errors. And we found many errors with when something is misheard. So, I might say a word which AI picks up something else, therefore changing the whole context of that sentence. So it's important that you regularly, you review those notes that prescribed and make sure that it's relevant. Because ultimately, GPs using AI Scribe are responsible for ensuring that their patients' health records are accurate and up to date. Making the right choice is something you should spend some time on. It's not something you should just jump onto the first one that's available. You need to make sure that the choice you make is right for you. So take advantage. All of the software programs that we have tried in our practice have a free trial period where you can use it, see how it works, does it meet your needs, is it lacking something, and then try them all. Try them all for 30 days. It's free. And that allows you then to say which one works best for you. Some directly integrate within your software, some don't. Personal preference, prefer the ones that don't integrate, just for that added level of security and privacy. I don't want the two actually be talking to each other. So you need to also consider the time required to set it up, how it integrates with current clinical information. So Lyrebird, for example, integrates directly with best practice. So it's something that you won't have to copy and paste from. Other platforms are working on that integration. As I said, we've gone for the standalone version purely for the course of privacy and just that little bit of added security. The time and accuracy of the output. How quickly does it create your notes and how accurate are they? They're all different. Availability of user, trainer, and ongoing support. What services do they provide you for ongoing support, particularly around creation of new templates, any problems you may be encountering using the platform? Also consider the ongoing effort needed to review the AI's performance and suitability. So you need to remember, once you start using something, you don't just stop there. You need to continue to review its progress, review other services to see whether things have changed. They are changing and expanding so rapidly. And is it portable? Can you take it away with you? So we use it. We use Heidi. Heidi has an app, so my GPs can take their phones to the nursing home or to a home visit, use the Scribe while they're with the patient, and then they can create their notes, open it back up on their desktop when they get back to work, and the notes are all there, sitting there ready for them to copy over. So again, that whole time saving, but best part about those comprehensive notes to remind you what it was that you were going to do for that patient, particularly if you're seeing multiple patients, for example, within an aged care facility. So having that available to you is also really great. So now we know what it is, we need to look at ways of integrating it. How are you going to integrate it into your workflow? How will you adjust your clinical workflow? Will you adjust your clinical workflow? So introducing AI Scribe should have minimal impact on the way you conduct your consultations. Instead, doing so should actually make the process of taking notes during consultations easier, not harder. But you need to ensure time is set aside to review the clinical documentation, as I've already said, making sure that it meets, that there's no words misspelled or that it's not misinterpreted something. You need to remove any inaccurate information or documentation that's not relevant. Document patient's consent is really important. We're going to cover that off in a short while because it is vital, mandatory that you obtain consent for patients when you are using AI Scribes. And then you may need to add other clinically relevant information, and we're going to talk about that in a moment. So AI Scribe is wonderful, but it can't give you everything. And of course, even if recorded in the consultation notes, things like observations or measurements that you take, examination findings, reviewing investigations, none of that is going to drop into the notes if there's something you do without speaking. So you might look at the results but not actually talk about them. So ensuring that you put in things like, results of LFTs given. So making sure that you tick all those boxes to complete your consultation, because that will not be integrated. Although GPs using AI Scribe may spend less time typing, you are going to, and less time facing the computer, the process of checking the output is going to take you a bit of time. So it may initially reduce the amount of time you save, but as your workflow improves and as you get familiar with it, you will find the benefits will then far outweigh. You'll be able to efficiently create those notes quickly and comprehensively. GPs might require training. So it's not something you just open up and say, right, I'm ready to go. You need to make sure that the provider you choose does have the option for training if you require it. I found the easiest way was just to get in there and start using it and see what it's got for you, because that is where most of the training is taken place when you're actually in action. They can also make errors. I've said that before, and it is only as good as the speaker or the microphone that you have. If you're a fast speaker like me, it may have trouble keeping up with me, so it may misinterpret some of the words that I've spoken. So when you're looking for your accuracy, you need to filter out pertinent information, classifying it as irrelevant. So what it might do is actually filter information that's not relevant and classify it as irrelevant or is relevant, beg your pardon, filtering out information that is relevant as irrelevant. So therefore it won't capture it in your clinical notes, which is not what we want to hear. Mishearing the names of symptoms, medicines or conditions as a result of the speaker's accent or use of slang terms perhaps, but in my case, just because of the speed that I talk at. Sometimes they can incorrectly categorize, so confusing historical and current symptoms. So the patient may talk about something they've had in the past, and it may actually add it into the current symptoms that patient's presenting for. So you can see there's lots of areas where there's still much room for improvement. These areas then might be carried over to other areas of the patient's health record, giving either misleading or contradictory information. So really you need to read what the gist of all this is. You really do need to read those clinical notes to make sure that you are putting across into your health record something that is completely relevant to that patient. Be careful, because as AI Scribe gains popularity, and it is gaining rapidly, doctors are working out that, wow, this is game changing for me. My notes are better than they've ever been before. They're comprehensive. It's great. It's easy to become over reliant. So using it without really forgetting how to do your own notes. So try not to use it for everything. Particularly for patients it's great for patients who've got multiple symptoms or lots of things to discuss, but just keep in mind you can become over-reliant on it. You therefore may pay less attention to critical clinical details. So knowing that AI Scribe's going to capture everything for you, it's quite easy to sort of disconnect a little bit from, when we're writing notes, we're constantly listening to the patient and thinking and sort of analysing in our head. By this doing it for you, that it's more of a conversation, and there's risks that you will miss or forget something that was heard. And sometimes we forgo those vital process of checking the output. So as we think, yeah, all good, it's working really well, we tend to become a little bit complacent with checking the output and find that later there's been errors that were not detected at the time of consult. So it has happened in my practice. So it's really worth being aware of that, I guess. So GPs in training, registrars, and anyone new to general practice should be encouraged to develop clinical documentation skills before using AI to ensure this skill is embedded in their learning. So young registrars, GPT-1, 2, any doctor who is new to general practice or new to that patient engagement and extraction of information shouldn't be using it until they have honed those skills a little better. What backup process do you have in place? So you need to consider also what backup process you're going to have in place if something happens. Worst scenario, your computer crashes or the internet goes off or power goes off. How are you going to then capture the consultation in next time? The patient will be gone. You'll then need to revisit that consult in your mind to work out what it was that was discussed prior to that interruption. Like I said, whether it be a power shortage or something that significantly impacts on your ability to complete the consult in the AI version. So avoid relying on AI. This is another really important and relevant point. There are AI scribe systems that will generate MBS potential. So I think MBS Pro is one of them, where at the end of your transcription, it will say to you or potentially identify you item numbers that you can charge. Now, we found out the hard way with this one. One of my GPs was having a discussion with a patient about potential care. A patient was planning a pregnancy, and that discussion was had about the word pregnancy, and the doctor then put up an antenatal service item number. She was new to general practice in Australia and she wasn't aware, and she charged a patient who was not pregnant an antenatal service. So you need to probably be aware if you are using a service that does nominate potential item numbers, that you carefully check those to make sure that they are actually relevant, because it's important that you actually ensure that the item number that you are charging is completely relevant to the consultation that you just had. Okay, I did talk about this before, and I think this is super, super relevant. Privacy and confidentiality. There's big fears. One of the biggest, I think, deterrents for people using AI is the risks for privacy and security. So how are we going to ensure our patients' records are kept secure? So this is where the questions need to start when you are looking at what provider you're going to choose. So a data breach can occur if any of the audio recordings, text transcriptions, or clinical documentation that's prepared by the AI scribe are intercepted. Now, they are encrypted, I believe. Most of the AI scribes that we use are encrypted, but hackers are getting smarter and smarter. So we need to make sure when we're choosing a provider that we consider this. GPs should be aware of what the assurances are from the AI scribe software vendor around how the data is captured, encrypted, stored, destroyed, and managed more broadly. So ask those questions. Is the data encrypted? Where is it stored? How long is it stored for? What format is it stored in? And in addition, practices will benefit from developing their own policies and procedures for managing information security. So you will need to update your privacy and security policy to include AI, because that's going to be part of the way you work. So keep that one in mind as well. So software vendors might use collector, and the other issue is will the information that's collected be used elsewhere? So there are potentials for some software providers to use the collected data for secondary purposes, such things as training. They might use it for training AI models to improve the digital scribe or develop other AI products. They might also on-sell the data to a third party, and however, they do have an obligation to provide you with this. So if you've got any of those bodies or those organisations that you're considering, I'll be making sure that there is no potential for the on-selling of data that you collect. Of course, GPs and practices when considering AI scribe, you should review the terms and conditions of the agreement to ensure all that information. So where is it stored? How is it stored? Is there any secondary use or third-party use? and consider whether any secondary data specified in the user agreement is appropriate and acceptable before purchasing the project. So you might be happy for some of that information to be shared, particularly as it is de-identified. But I think for that whole security of our records, you know, I would be steering away from providers that actually do share data with other organisations, because it's not ideal, in my opinion, I guess. So GPs and or practices will need to check whether the data is collected will be processed or stored outside of Australia. Now, most of them are stored within Australia. However, there are also providers that store outside of Australia, so you need to be aware of that. If data is processed or stored for any amount of time overseas, vendors that provide the service for you must ensure that the country where the information is stored meets the privacy standards of Australia. So there are standards that they must meet. And if the vendor cannot provide those assurances, it's really advisable to avoid their products, because we want that surety that the information is going to be safe. GPs or practices are also encouraged to investigate if the AI tools will meet the needs of their patients. So look at what potentials each have for you. So as you can see, it really is going to be a benefit for you to actually trial more than one version, just to see what works for you. Currently, Australia has no specific legislation around AI, big data, or any form of automated decision-making process. However, new provisions in the Privacy Act that will come into effect in December 2026 will extend the application of the APP to certain automated decision-making processes. So this will affect AI scribes. So there is going to be it's going to be included in the Privacy Act. So we need to remember that it's still 12 months away, and there's still so much can change in 12 months, but it is going to be covered. And it's also one of the, if you're not familiar, come 2026, when the 6th edition standards comes into play, there is a new requirement around artificial intelligence. So they have written that also into basically to the standards come 6th edition. So the potential of using AI Scribe must be weighed against the risk. So I really want you to understand that. Yes, it's great and it's easy to use and it's really time saving, but you need to examine the risks and ensure that you are selecting the right provider. If you're an owner or you're a practice owner running a practice, you will need to develop a policy. So you're going to make sure that you have a policy in place, and that all of your GPs or all of your practitioners know the policy. It can be used with your nursing staff. A couple of my nurses use it, particularly when they're doing chronic disease management. It's a great way to then pre-populate care plans, works a treat. So if you haven't tried it yet, give it a go. But the details you need to include in that policy will be which AI scribes are permitted. So you might, because GPs can make choices, you don't need to use the same scribe. So you might have, in my case, 22 GPs, and they may all use different platforms. Therefore, as a practice owner, you need to ensure that you are A, happy to have that, or B, if you're not, that you list clearly what is an acceptable platform for you to use, particularly after you've done your research about what is and what isn't, and what does and what doesn't meet the needs of your practice. Details on how to report privacy breaches must be included, along with cybersecurity incidents or errors in recording caused by the AI scribe. So nothing unusual. We still need to report any breaches of data. If you make the decision not to permit the use of AI scribes or wish to limit the use of a particular scribe, you'll also need a policy to inform all tenant GPs and staff of this decision. So as a practice owner, you have the overarching power to decide whether you use it or not, or to what capacity that you use it in. And you should remember that when you've got GPs coming on who want to use AI scribe. And not only is it about putting a policy in place, it's about how are you going to monitor it? How are you going to be sure that the GPs that you have got in your business are actually prescribed or complying with your policy that you've created? So you'll need to update your privacy policy to inform your patients about your practice's use of AI Scribe to assist you within the generation of clinical notes. So, there could be something you put up on the wall, could be on your practice website, but it's also a conversation that should be had with the patients at the start of each consultation. Once you have received consent from a patient once and it's documented, usually somewhere where it's visible, you don't need to continually get consent. That consent is valid until the patient withdraws. Okay, so you don't have to continually get consent. You just have to get verbal consent. So get that written consent once, and then future then is, I'm going to use AI transcription again today. Are you okay with that? We have used it in the past, and get that patient's consent each and every time, because sometimes the consultation they're coming for, they may not want that use. They might want it a more structured or less wordy consultation, I guess. Consider providing patients with information about any AI Scribes in use and how they work. And of course, you could achieve this through signage in your practice. On the patient enrollment form, you can put a dot box that says, we use AI transcription services. Do you consent to this? And you've already got their consent at the first point of call when the patient first becomes a patient with your clinic. And you can do things like hot doc broadcast where you send out information to patients. We are now using AI Scribe to allow our GPs more time to spend face-to-face with you. Please let the doctor know if you don't want to participate. So lots of ways you can do that. The implementation of AI tools requires ongoing due diligence. As I said before, you need to continue monitoring the performance to make sure it's working for you. And usually your licenses are yearly, so don't feel if you choose one service that you are stuck with that service. If you choose to change, that's okay. It's up to you when you do it and how often you use it. Sometimes you can have an agreement or a license with one and then hear great things about something else. So take that trial, use that demo and see whether it works better for you, because each GP is going to be different. Each GP's needs are going to be different. Make sure you facilitate initial and ongoing education. So making sure that all of your users know how to use it properly so that they are making the most out of it. If you're just using it for transcription, that's great, but there are so many more opportunities to use. So make sure you're aware of what they are and how they can help. And in my practice, we got one GP to basically spend a lot of time and learnt it all. And she has then transfer that information to the other GPs in a group learning session at the practice. So that worked really well for us. So the other thing to consider when you're looking at vendors is, do they have online training? Are they constantly updating their training to reflect any new resources that they are providing? So when considering the use of AI in your practice, you need to consider, are you satisfied with what's been provided? Is there enough evidence of the product's safety, efficacy, and how applicable it is for use in your practice? Is there published data on the clinical basically on the validity and safety of that particular AI Scribe? And please, before implementing anything into your practice, make sure it's a tested, known platform, it's suitable for your intended use, and it meets your clinical needs, because that is so important when you're looking at implementing a new system in your practice. So next we're going to look at patient consent, because this is key. If you don't get consent from the patient, there is risks of possible medico-legal issues later. So the patient, all our patients have the ethical and legal right to make an informed decision about their health. And part of this is around the Privacy Act. So consenting on the basis of Privacy Act and the permission of collecting and the use and disclosure of information, which we're all fully aware of. To minimise the risks of legal issues, you must obtain a patient's informed consent. Now, it might be reasonable to consider that the patient's here and they're willing to participate in the consultation, so they're consenting. It is recommended that you get a signed consent form on the first instance, and then retain that for future uses, because that will cover you in the event. We had an instance where a patient signed the form, but then rang the next day and said, no, I've withdrawn my consent. I've been researching it. It's not safe and I'm not happy. So that's fine. We just took out the note that said consents to AI Scribe. We shredded the consent form and the patient was happy. So keep in mind your patients can choose to change their mind, particularly if they get home and start Dr. Googling what potential risks are around it. So health practitioners need to involve patients in the decision. So you need to educate your patients on what it is you're going to do and how it works, ensuring that you are provide open disclosure about the fact that it is de-identified, it's encrypted, it is only for my use. No one else is going to be able to view to listen to the audio from today. And once I have seen you and my notes are completed, I'm going to delete it. So that's a really good reassurance for the patient, I think. So informed consent is particularly important when recording those consultations that may have criminal implications. It could be an incident post assault, or it could be someone who's come in who's had domestic violence. So all those things, we need to be sure that we are recording the right information and that patient has consented to that. So that's really important as well. Now, I'm going to cover off on the most common questions that my GPs had, just so that we're sure. So I'm sure that I'm covering everything for you. And please, then at the end of that, we're going to have a look and see if there's any questions that anyone would like answered, directly. So, have GPs been involved in the development of the AI Scribe? So, yes and no. The RACGP certainly advocates for GPs to be involved in the development of any technologies designed for us to use. So why would you implement something if you don't know what we need? So there has been a lot of talk about that. GP's insight is essential for ensuring that these technologies fit our needs. They're useful, they're practical, and they're effective. You must understand the complexities of patient care. GPs understand that a software vendor may not, or someone who creates some kind of platform may not understand that. So for these reasons, it's advisable that when you're considering your AI choices, that you ask, has a GP had any input into the development of this? Because that's really important to us, and I'm sure it is to you as well. Can AI Scribe vendors confirm the tool is compliant with relevant Australian legislation? So make sure they can say, yes, we meet the Australian Privacy Act and we meet the Australian privacy principles, and we are in accordance with the Privacy Act 1988. So that should be clear right from the start that yes, we are basically meeting all the relevant information, or the relevant data security points. Is data collected by the AI Scribe processed and stored in Australia or overseas? So there are multiple platforms, and most of them are stored in Australia. However, I do believe there are some that are stored offshore. So ideally, any personal data that is collected by AI Scribe, you must ensure it's stored in Australia. That would be my preference, making sure it's not stored offshore. However, the AAP does create a framework, or has created a framework, that does facilitate cross-border information. So there are standards set for sharing of information across certain borders. So you need to be sure if data is stored offsite or offshore, that it's stored in one of the countries that has that agreement with our APP. And there is lots more information if you want to check that out on the Office of the Australian Information Commission. So they've got a big, information section on AI Scribe and how that looks and where the information is stored and what companies store it where. So that's probably worth having a look at as well. Can data collected by AI Scribe be used and then sold for secondary purposes? We have talked about this, and as I said, most AI Scribes will not on-sell the information they collect. However, you must be sure that you ask the question to determine whether the service does offer that. The de-identified data should not include recordings of patients' consultations, which, as we know, most of them delete the actual recording and only save the text-based. And information on this will be found on the product's terms and conditions. So don't be frightened to look for that when you're looking at your contracts or what you might potentially want to use. So finally, we're going to look at the future. Oh my gosh, the future is limited for AI. There is so much information. There's so much expectation of how AI will grow. They're talking about populating data to, for entry, so being able to enter fields with your height, weight, all those things. Multilingual, I'll get that one right. Transcription, so just, patients speaking in Chinese will automatically transcribe into English or any other language. Lots and lots of potentials. We've been using it for 18 months now, and the growth that we've seen in just that 8 months is phenomenal. So it's just going to keep going ahead in leaps and bounds. Now, I do want to really quickly touch on another AI app which we use, which you may find beneficial if you're not aware. It's called Better Consult. Now, Better Consult is basically a pre-consultation application. It basically sits alongside any clinical software that you use, integrating, and it basically, when a patient books an appointment and that GP is registered for Better Consult, it sends the patient a questionnaire either via SMS or email, where the patient answers a series of questions, which will then allow the GP to see those responses. So when you open the file in the morning, you might want to check your list for the day, and you see a Better Consult wording against a text, a patient, you'll know they have replied to the message. You'll be able to quickly look at that and see why the patient is coming. It allows you then to prepare for the consultation, and it may be that you need to adjust the length of time. They may have listed multiple things they're coming for and only have a 15-minute appointment. So it gives you an opportunity to either rebook that patient, extend that appointment. So it gives you a good idea of what your day is going to look like. And the patient may not have results back the patient's coming for. So a patient may be booked for review of results, but those results aren't actually back in yet. So it allows you to identify those really quickly and make sure that your day is within your control, basically. That's what it looks like on an SMS based. It basically sends a text to the patient asking them several questions. The patient books the appointment, they get a link, and there's a series of, really quick, short answers that the patient will complete, which then will populate. And what it uses is things like presenting symptoms, related symptoms, what medications they're taking, any relevant history, allergies. So it's probably takes a patient maybe 5 to 10 minutes to answer, but it certainly informs your decision at a later date. So you're going to then get something that looks like this, which is basically, this is a really short version where the patient has replied to each of those questions. So looking at that quickly, you can see what the presenting symptoms are, and how long the patient's had it for, what they're using. So it's a really great, my GPs love it. And you can also use those notes to copy into your software. So if you don't want to go down the AI scribe pathway yet, but want something that's going to help you to prepare and manage your appointments, then this is also a great way to do that if you haven't already considered it. So in summation, ladies and gentlemen, we're just at the beginning of our AI journey. It's been around a couple of years. It is growing significantly and will continue to expand. GPs will need to work side by side with these tech companies, however, to ensure that what comes in the future is actually going to be valuable and time-saving to us. So we're the ones that know what we need. Consider what program is best for your practice and clinicians is important, with the aim to reduce the onerous task of note-taking, letter writing, care planning, and allow you, the GP, to spend more time interacting with the patients. And I'll leave you with 4 words: practice medicine, not paperwork, because it really is a great way for you to spend time face-to-face with the patient, engage them, have a conversation with them. And the feedback we've had so far has been nothing but positive. Patients felt more in tune with the GP and felt that the consultation was really a conversation and not just a GP with their face away from them typing on a computer and just looking backwards and forwards. So I'd be really interested now to hear from anyone who might have some questions or want to comment on anything that's been talked about today. Were there any questions?
Yeah, there's a handful in the chat, Wendy.
Oh, okay. Yep.
Yeah, so I'll just go through as they arrived. From Dr. Olataga. So what is the cost per license, full-time, part-time?
Good question. So with the licenses, it depends on the company. Now, I can give you an example of what we pay. So we're a large GP practice that they've given us. You can either choose to have a license individually or you can have a practice license. So Heidi offered us a 24 GP license as a sign-on bonus, and it cost us $1,500 in total for the year. So for the whole every GP, every service, it cost us just $1,500. When our license renewed, they negotiated, it was like a honeymoon period. So please negotiate with them. Don't just take the first figure. We now pay, our GPs pay around $800 each. Our registrars are free. So we get a practice license. Each GP contributes the benefit, whatever they want. So say you've got 20 GPs or 5 GPs, they would then contribute, their percentage of the cost. They can take it with them when they go. It's not, they don't have to be at your centre to use it. That I can only comment on that, but I believe most of them are similar. You can pay by the month if you choose, but don't let them roll you. So when you have that conversation, barter, because they're keen. The competition's getting heavier and heavier. So negotiate for a practice license with all your GPs and see if you can beat them down a little bit.
Second one is, can AI scribe translate other languages to English yet for documentation?
Yep. So when you create the notes, they are transcribed in English, but you can then generate the notes into another language if you want to.
Awesome. The other one is from Dr. Olataga again. How, after we do the transcript and put it in the notes, are we supposed to delete the transcript?
Yes. So I can see a little bit further down, someone saying it just screams risk. The fact that information is stored scares the hell out of me. So let me be clear. It is only stored for a certain period of time. You can delete it straight away and it's stored nowhere. So basically, if you delete the information directly after the consultation, the information does not get stored anywhere. If, however, you want to ensure you can access those notes for a week, perhaps, then it's stored. Trust me when I tell you they have jumped through a lot of hoops to get this platform working, and there are stringent privacy and security issues around it. So they have done the due diligence as far as protecting the data. There is always a risk, but there's a risk with everything we do. So I don't see any more risk to this than anything else we do in general practice.
Thanks, Wendy. Which I think that's related to Miss Elstor's question as well earlier, that the speech captured cannot be replayed at a later date by anyone and is not stored. But is the text stored? Is
Yes.
that the
So
answer?
the audio will be gone forever. It does not, it stores the audio in the transition between listening to the consult and creating the notes. Once those notes are created, the audio is gone. You can't replay it. No one can access that information. So, and even when you're looking at the notes when they're stored, you don't enter a patient's name in there. So even if the information is breached, there is no patient's information. It's purely just a conversation that's been recorded and transcribed. It puts it into, I should have probably clarified this, when the notes are created, you can choose what format they're created in. So a lot of my GPs have the SOAP format, and it's then created in the SOAP format, or they can create it in multiple different ways. So you might prefer just a reason for visit and then the presenting symptoms. it will learn from you. So if you continue to change the way it's created, it will learn and it will start to create your notes. But the data, the text, the voice, I beg your pardon, is never kept, and the data can be deleted straight away. So you can be sure, if you're worried about hacking or access for data at a site level, that will not happen because you delete it straight away.
Where can we
Yes.
get consent form?
Yeah. So once you choose a provider, they will provide you with a consent form, which is applicable to their practice, or you can create your own. It's a really simple. We are now, our GPs are using AI transcription services. You can, the consent forms from the providers are really good. They explain it, but you can certainly create your own. And you can, as I said earlier, put it into your new patient form, a little section, because we have our privacy principles and the way we use patients' data and store it anyway. So, you know, when I was going back to that person that said that, you know, the fact that it's stored, but we store all our data. So it's no more risk, you know, when we do consultation notes, they're all stored. So I think it's just getting that confidence to give it a go. And like I said, if you are concerned, don't go for one that directly integrates. So, you know, like I said, we chose Heidi, and I'm not promoting Heidi. We just chose it because that's what worked best for our practice and our practitioners. But it does not integrate. So unless there is no integration, so there's no direct contact between your clinical software and the AI scribe. So you've got that little bit, I guess, peace of mind. And remember, there's no names. So there's no risk of a patient being identified from that. And yes, the AI can differentiate between the doctor and the patient. So it's actually amazing. And I really encourage you, if you're just sitting there thinking about it, give it a go. It can't hurt, but it certainly is worth giving it a trial, seeing how it works. And then, yes, it's basically cut and paste. So before you put the information into your software, it will come up in a beautiful presentation and it says copy notes. And then you basically copy, Control V or paste, and everything pops into your software, into your today's notes. But you can generate care plans, referral letters, all those things directly from Heidi that will then, or your platform, that will then be able to be saved into the patient's notes as well. So it's just fantastic. And then delete from Scribe, exactly. Thank you, Elsa. Yes, cut and paste and then delete from Scribe. That's exactly right. The other thing it does do, which we find beneficial, I know we're running out of time, so I'll be really quick, is it provides you with notes, but it also provides you with a full transcript of the conversation. So if the patient has complaints or issues after, the GP can then show, and this happened to us, patient complained about the GP and the way they spoke to her and felt that they were dismissive. So the GP showed me the actual transcript of the consultation, and it was nowhere near what she actually said. So it can be beneficial just to remind the GP of what was said so they don't forget anything as well, because that's really important as well.
So I think we're on.
I think we got one more question from Zen about informing medical indemnity insurance about the use of AI Scribe.
Yeah, so there's no requirement to do that. However, you can be guided by your MDO around any questions you may have. So if you're concerned, there's a great article on Avant's website about the use of AI in general practice, which is, I find, if you're sitting on the fence or want to be sure, ask them. But the MDO will make no ruling as such. They sit on the fence basically. But I think knowing when that the accreditation standards are going to incorporate AI, we are going to have to then probably be a little bit more diligent about the processes, because we're going to have to meet the accreditation requirements around it.
I think I'm mindful of the time, so I'm going to pause this one.